Hello students, welcome to the learning session. I am Yogitha. Our subject is Psychiatric Nursing and today we are going to learn about the terminologies. And our today's letter is M. M for monkey. Okay, so let us study all the terminologies which comes in Psychiatric Nursing which start with the letter M. First, mental health. Now, mental health is a condition of individual where they are able to get adjust themselves to their internal and external environment. Person is able to cope with his feelings, thoughts, ideas, so that he can live a happy, a social, occupational and personal life, and physically he is not able to make a necessary changes to cope with his environment. Such condition is called as mental health. Next, mental illness. This is a condition or state which is exactly opposite to that mental health. Patient or the individual is not able to make an adjustment with his internal and external environment. He is finding a lot of difficulties, disturbance in his thought, ideas, belief and his practices. He is not able to lead a sound family, social, occupational functioning system. So lot of disturbance will make the persons to not to get easily adjusted to his environment. So this condition is called mental illness. Next, maladaptation. So maladaptation is a condition where the individual is not able to get adjust to his environment. A person who is not make a necessary change in his behavior so that he will get fit into his environment where he is. So here they may express a stress, anxiety, irrational fear or uneasiness to their environment. This is called maladaptation. Next, mania. Mania is a bipolar disorder. It also called as mood disorder, where it characterized with elevation of his mood. His mood will be disturbed. Now this mood can be seen in 4 stages: euphoria, elation, exaltation and ecstasy. And also mania is characterized with manic episode, hypomania, mania with psychotic symptom, mania without psychotic symptom, mania with undifferentiated and other specific manias. So this is what called mania. Next, manipulation. You by the word itself will understand that we are changing something, we are bringing some changes or manipulating the things. Now manipulation means is a condition which interact with the interpersonal relationship of individual. Here individual is bothered about his own needs and comfort, and there is no consideration for the opposite person, and he is changing the things without the consent of others. This is what called manipulation. Next, mental retardation. Mental retardation is a condition where we can see an intelligent quotient. It's subnormal average intelligence of an individual. Mainly in children we can see this condition, mental retardation. Here the IQ of an individual is less than 70. Now this mental retardation is again further classified into mild mental retardation, moderate mental retardation, severe mental retardation and profound mental retardation. Next, malingering. Now here malingering is a condition where patient is exaggeration of his illness. I can give you an example here. Maybe a patient has got little headache, but he will exaggerate in so big way that I got headache. It may be because of brain tumor. I was not able to sleep whole night. I am not able to concentrate in anything. I have to go to a doctor. I have to find a best cancer specialist. See, it may lead to some brain infection, meningitis or encephalitis. See, a simple simple headache, it has turned into brain tumor. So this is what called exaggeration of his illness, called malingering. Next, monoamine inhibitor. Now, monoamine inhibitor is a group of drug which will inhibit the action of monoamine oxidase. Now, mainly this drug is used to treat depression. It is very effective in depression patient. Next, Masochism. Here it's a kind of sexual disorder. It also known as sexual masochism. Here a patient get a sexual arousal, sexual happiness by hurting himself. He want to hurt himself by other. Then only he is getting that sexual pleasure. So it's sexual pleasure. So this is a kind of sexual disorder. Next, milieu. The milieu means environment or setting. So mainly we can use as a therapeutic process, milieu therapy, where we are creating an environment which is more comfortable and convenient to treat the patient. So we can use it in a treatment process, so we can provide a maximum comfort in patient in his environment. So this is called milieu. Now, Munchausen Syndrome. Now here this is a disorder where person suffers like habitually get hospitalized with self-inflicted pathology. That means like individual want to go to the hospital and he get admit there by declaring some own diseases. He will go to the hospital. He himself say that some condition, I'm having severe gastric pain, I'm having stomach pain, gastritis. It may be because of some stomach cancer. I want to get admitted and rule out for the checkup. So this is so habitually he will each time he will go and get admitted in hospital. So this is what called Munchausen syndrome. Next, music therapy. Now, music therapy is a treatment process which used to treat the patient with psychotic disorder. We learned in detail in music therapy that different kinds of musics are used to treat the patient. Either active or passive, where patient is listening to the music which is recorded or live musics, or patient get actively involved in preparation of musics. So this is what called music therapy. Next is mood. It's an emotion of mind, a person emotion where it continuously falls and which also will color the psychological thinking of an individual. So this is a state of his mind. This is called mood. Now, maturational crisis. This is a one type of crisis where a maturational crisis person need to get adjust and accept the new role changes a pattern of his life where he is finding difficulty to adjust with that, like adolescence, marriage, childbirth. So such situations, each phase of life where he is getting adjust and coping and finding difficulty stage, this is called maturational crisis. And the last one is multidisciplinary team or mental health team. So here a group of people, a well-trained people are form a group to provide a qualitative treatment to a patient who suffer with mental disorder so that he can live a qualitative life and resolve his mental conflicts. So this team is called as multidisciplinary or mental health team, and it involves like psychiatrist, psychologist, psychiatric nurse, a social worker, patient. So these all people work together for the betterment of a patient. This is what called multidisciplinary team. So dear students, till now we learned the terminologies which starts with M. I hope you understood, and it's my humble request, please keep studying until you get thorough with all these terminologies. I say thank you to all. See you in next video.